Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is your child hyperactive or hyperadrenergic? Hyperactivity, of course, is part of the hyperactivity attention deficit disorder, ADHD, which means that there are unexplained shifts in the mood of your child, irritability, sometimes temper tantrums, distractibility, problems at school, the teachers complain, inattentiveness. Adrenaline is one of the primary hormones which is produced in excess in the adrenal gland whenever our body tissue is being offended, insulted, threatened, or injured in any way. This is an important distinction. This is a biologist's view of ADHD, hyperactivity attention deficit disorder. This is not a psychologist's view. I think it is most unfortunate that most psychologists, psychiatrists, and pediatricians do not pay any attention to the issues of nutrition, environment, and stress, which cause adrenergic state, which the child is literally has ants in his pants, to borrow that expression. Now this segment is part of my channel, ADHD channel, a Children's Health Core that you're watching right now. I would specially ask you to consider viewing the segment entitled Dr. Ali's Nutritional Protocol, Dr. Ali's ADHD Nutritional Protocol. I give you simple guidelines for a 4 weeks trial, and I want the body organs to speak to you. There is no really simple test, laboratory test that I can tell you to prove that. But if you did a urine sample and send it to a laboratory for organic acid analysis, the answer will be there. You can, of course, do more expensive neurotransmitter tests and the answer will be there. But I prefer urinary organic acid because it also tells you clear evidence of gut fermentation, mold allergy, problems with the adrenal function. What psychologists call ADHD, I think it is a monumental mistake for parents to accept it as a psychological disorder. It is a metabolic disorder. This is the core message that I keep giving in this channel on ADHD. There is another segment in this channel, your child, hyperactive or hypoglycemic. Another program, your child, hyperactive or insulin toxic. Please watch the program entitled 7 Stages of Insulin Toxicity. You cannot understand hypoglycemia or adrenergic state. You can observe your child. You are the mother or the father. You know it better than any pediatrician or psychologist or a teacher knows. The child is an angel on a basketball court with his father. And the child morphs into a demon, kicking the shins of her mother when she is asking the child to do homework. You know that story, you're familiar with it. I'm focusing on what can you do metabolically. These children nearly always have evidence of gut fermentation. That urinary organic acid gives you clear, unequivocal, objective, quantifiable laboratory evidence for what I'm saying. So please look at this. And the 4 weeks trial that I recommend in the program, Dr. Ali's ADHD Nutritional Protocol, I think you should test this out and let the behavior and the learning capacity and the well-being of your child be your guide. I think you will find it useful. There is an overwhelming probability that it will encourage you and your child. Children's Health Core is a non-profit trust founded by my wife Talat and I some years ago. Our vision is to focus on issues of toxicities of food, environment, and nutrition, and stress, the health issues of childhood and developmental matters. You can support our vision by forwarding this YouTube segment to the parents or the grandparents or the teachers of your children who have been diagnosed with ADHD syndrome. Several articles appear on the website www.kids123.org, and whatever I'm presenting in an abstract form in these segments is detailed at length at kids123.org. Thank you for joining me, and I hope you will support our vision. Thank you so much.